Understanding the foundational concepts in neurology, cardiology, microbiology, pharmacology, biochemistry, and genetics is essential for grasping how the human body functions and responds to disease. Neurology focuses on the nervous system, exploring how brain and nerve disorders impact overall health. Cardiology examines the heart and blood vessels, providing insights into conditions like hypertension and heart failure. Microbiology delves into the world of microorganisms, revealing how bacteria and viruses can cause illness. Pharmacology, biochemistry, and genetics together explain how medications work, how the body's chemical processes are regulated, and how our genetic makeup influences both health and disease. These disciplines are interconnected, each playing a vital role in clinical decision-making and patient care. Parkinson's disease is a progressive neurological disorder that primarily affects movement. It is characterized by a significant decrease in dopamine production within the substantia nigra, a region of the brain crucial for regulating motor control. This dopamine deficiency leads to a range of symptoms, with one of the most recognizable being the classic pill-rolling resting tremor. This tremor typically involves rhythmic movement of the fingers and hands when the muscles are relaxed. Over time, additional symptoms such as muscle rigidity and slowed movements may also develop. Huntington's disease is a genetic disorder characterized by the expansion of CAG trinucleotide repeats on chromosome 4. This mutation leads to progressive degeneration of neurons, particularly in the caudate nucleus of the brain. As the caudate atrophies, individuals develop distinctive involuntary movements known as chorea, which are abrupt, dance-like motions. The disease typically presents in mid-adulthood and gradually impairs both motor function and cognitive abilities. Over time, these symptoms become more pronounced, significantly impacting daily life. Multiple sclerosis is an autoimmune disorder characterized by the immune system attacking the protective myelin sheath that surrounds nerve fibers in the central nervous system. This demyelination disrupts the normal transmission of nerve signals, leading to a variety of neurological symptoms. One hallmark finding in the diagnosis of multiple sclerosis is the presence of oligoclonal bands in the cerebrospinal fluid, which indicate abnormal immune activity within the central nervous system. Additionally, patients may experience internuclear ophthalmoplegia, a condition that impairs coordinated eye movements due to lesions in the brainstem. These features help distinguish multiple sclerosis from other neurological diseases. Myasthenia gravis and Lambert-Eaton syndrome are both disorders affecting neuromuscular transmission, but they differ significantly in their underlying mechanisms. Myasthenia gravis is caused by antibodies that target acetylcholine receptors on the postsynaptic membrane, leading to muscle weakness that typically worsens with repeated use. In contrast, Lambert-Eaton syndrome involves antibodies against presynaptic voltage-gated calcium channels, resulting in reduced acetylcholine release. Clinically, myasthenia gravis often presents with ptosis and diplopia, while Lambert-Eaton syndrome is characterized by proximal muscle weakness that may improve with activity. When tested with idrophonium, myasthenia gravis usually shows a marked improvement, whereas Lambert-Eaton syndrome shows little or no response, but may demonstrate increased strength with repeated muscle use. Myocardial infarction, commonly known as a heart attack, is diagnosed through a combination of clinical assessment, electrocardiogram findings, and laboratory tests. Among the laboratory markers, troponin and myoglobin play crucial roles. Troponin is highly specific to heart muscle injury and rises within hours of an infarction, making it the gold standard for diagnosis. Myoglobin, on the other hand, increases more rapidly but is less specific, as it can also be elevated in skeletal muscle injuries. Together, these biomarkers help clinicians confirm myocardial infarction and guide timely treatment decisions. Cardiac murmurs are abnormal heart sounds that can indicate underlying valve disorders. Aortic stenosis typically presents as a harsh systolic murmur, best heard at the right upper sternal border, often radiating to the neck. In contrast, Mitral regurgitation produces a blowing, hollow systolic murmur, most prominent at the apex, and may radiate toward the axilla. Clinically, patients with these murmurs may experience symptoms such as shortness of breath, fatigue, or chest pain, depending on the severity of the condition. Careful auscultation and recognition of these characteristic sounds are essential for accurate diagnosis and management. Atrial fibrillation is a common cardiac arrhythmia characterized by an irregular heart rhythm. This means that both the timing and strength of heartbeats are unpredictable, which can increase the risk of blood clots forming in the heart. To assess a patient's risk of stroke and determine the need for anticoagulation therapy, clinicians use the CHADS-VASc scoring system. This tool evaluates factors such as age, history of heart failure, hypertension, diabetes, and previous stroke. Accurate scoring helps guide treatment decisions, aiming to reduce the likelihood of serious complications. Heart failure is a condition in which the heart is unable to pump blood efficiently, leading to symptoms such as fatigue, shortness of breath, and fluid retention. One important marker for diagnosing heart failure is the level of B-type natriuretic peptide, or BNP, which tends to be elevated when the heart is under stress. Elevated BNP levels can help clinicians confirm the presence and severity of heart failure. Treatment often includes medications like ACE inhibitors, which have been shown to reduce mortality by lowering blood pressure and decreasing the workload on the heart. By addressing both symptoms and underlying causes, these interventions play a crucial role in improving patient outcomes. Endocarditis and pericarditis are both inflammatory conditions affecting the heart, but they differ in key features. Endocarditis primarily involves the inner lining of the heart and is often characterized by the presence of vegetations on the heart valves. In contrast, pericarditis affects the outer lining of the heart, known as the pericardium. A classic symptom of pericarditis is chest pain that improves when the patient leans forward, a result of reduced pressure on the inflamed pericardial layers. Recognizing these distinctions is essential for accurate diagnosis and effective treatment. Several important bacteria play significant roles in human health and disease. Staphylococcus aureus is known for its golden yellow colonies and its ability to cause skin infections, pneumonia, and even bloodstream infections. Streptococcus pneumoniae is distinguished by its lancet-shaped appearance under the microscope and is a leading cause of pneumonia and meningitis. Neisseria meningitidis, often referred to as the meningococcus, is recognized by its coffee bean-shaped diplococci and is a major cause of bacterial meningitis, particularly in young people. Each of these organisms has unique characteristics that aid in their identification and guide appropriate treatment strategies. Viral pathogens are microscopic agents that can cause a wide range of diseases in humans. Among them, the Epstein-Barr virus is notable for its role in infectious mononucleosis, often referred to as the kissing disease, and its association with certain cancers such as Burkitt lymphoma. Hepatitis B virus, on the other hand, primarily affects the liver and can lead to both acute and chronic hepatitis, increasing the risk of liver cirrhosis and hepatocellular carcinoma. Understanding these viruses and their related illnesses is essential for effective prevention, diagnosis, and treatment strategies. Protozoal and fungal infections can present with a wide range of clinical symptoms, depending on the organism involved. Plasmodium falciparum, a protozoan parasite, is responsible for the most severe form of malaria, often causing high fevers, chills, anemia, and in some cases, complications such as cerebral malaria. On the other hand, Candida albicans is a common fungal pathogen that can lead to infections ranging from superficial oral and genital candidiasis to more serious systemic candidemia, particularly in immunocompromised individuals. Recognizing the distinct clinical manifestations of these infections is crucial for timely diagnosis and effective treatment. Clostridium difficile, Mycobacterium tuberculosis, and Vibrio cholerae are notable bacteria responsible for serious human diseases. Clostridium difficile often causes severe colitis, particularly after antibiotic use, leading to inflammation and damage of the colon lining. Mycobacterium tuberculosis is the causative agent of tuberculosis, a disease marked by the formation of granulomas in the lungs and, in some cases, other organs. Vibrio cholerae triggers cholera, characterized by profuse watery diarrhea due to its toxin-disrupting water absorption in the intestines. Each of these pathogens demonstrates unique mechanisms of causing disease, resulting in distinct clinical presentations and challenges for treatment. Aspirin works by inhibiting the enzyme cyclooxygenase, which reduces the formation of thromboxane and ultimately decreases platelet aggregation. Heparin acts as an anticoagulant by enhancing the activity of antithrombin 3, leading to the inactivation of several clotting factors. Warfarin, another anticoagulant, interferes with the synthesis of vitamin K-dependent clotting factors in the liver. ACE inhibitors, or angiotensin-converting enzyme inhibitors, lower blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. Each of these agents plays a distinct role in managing cardiovascular conditions by targeting specific pathways in the body. Metabolic and cardiovascular drugs play crucial roles in managing various health conditions. Metformin is commonly prescribed for type 2 diabetes to help lower blood sugar levels, while insulin is essential for both type 1 and advanced type 2 diabetes. Atropine is used to treat bradycardia, or slow heart rate, and can also reduce saliva production during surgery. Propranolol, a beta blocker, helps control high blood pressure and certain heart rhythm disorders, but may cause fatigue or dizziness. Albuterol is a bronchodilator used for asthma and other respiratory issues, though it can sometimes lead to tremors or increased heart rate. Vancomycin, an antibiotic, treats serious bacterial infections, but may result in side effects like kidney toxicity or hearing loss. Inherited metabolic disorders are a group of genetic conditions that disrupt normal metabolic processes in the body. These disorders often result from mutations in genes that encode enzymes responsible for breaking down or converting specific substances. For example, phenylketonuria is caused by a deficiency in the enzyme needed to process phenylalanine, leading to its accumulation. Alkaptonuria results from a defect in the enzyme that breaks down homogentesic acid, causing it to build up in tissues. Maple syrup urine disease arises when the body cannot properly metabolize certain amino acids due to enzyme deficiencies, resulting in distinctive symptoms and the characteristic sweet-smelling urine. Genetic syndromes like Lesch-Nyhan, Marfan, and Down syndrome each arise from distinct molecular abnormalities. Lesch-Nyhan syndrome is caused by a deficiency of the enzyme hypoxanthine guanine phosphoribosyltransferase, leading to neurological and behavioral disturbances. Marfan syndrome results from mutations in the FBN1 gene, which affects connective tissue and can cause cardiovascular, skeletal, and ocular complications. Down syndrome, also known as trisomy 21, is characterized by an extra copy of chromosome 21 and presents with intellectual disability and unique physical traits. Understanding the molecular basis of these conditions helps guide diagnosis and management. Cellular metabolism is the process by which cells convert nutrients into energy and essential molecules. Glycolysis, the first stage, occurs in the cytosol, where glucose is broken down into pyruvate, producing a small amount of ATP and NADH. The pyruvate then enters the mitochondria, where the TCA cycle, also known as the Krebs cycle, further processes it to generate electron carriers like NADH and FDH2. These carriers transfer their electrons to the mitochondrial inner membrane, driving oxidative phosphorylation. This final step produces the majority of cellular ATP, efficiently powering various cellular activities. In modern medical practice, the fields of neurology, cardiology, microbiology, pharmacology, biochemistry, and genetics are deeply interconnected. Understanding the nervous and cardiovascular systems provides a foundation for diagnosing and treating complex diseases. Insights from microbiology reveal how pathogens interact with the body, while pharmacology guides the safe and effective use of medications. Biochemistry and genetics offer a molecular perspective, helping to explain disease mechanisms and individual variations in health. Together, these disciplines create a comprehensive approach to patient care, highlighting the importance of integrated knowledge in advancing medicine. Understanding the core principles of respiratory, renal, gastrointestinal, endocrine, and hematologic medicine is essential for grasping how the human body maintains balance and responds to disease. Each system plays a unique role. The respiratory system manages gas exchange, the renal system regulates fluid and electrolyte balance, the gastrointestinal tract oversees digestion and nutrient absorption, the endocrine system controls hormones, and the hematologic system is responsible for blood production and clotting. Recognizing the clinical significance of these systems helps in identifying and treating a wide range of medical conditions. Major distinguishing features, such as the lungs' role in oxygenating blood or the kidneys' function in filtering waste, provide critical insights for diagnosis and therapy. Asthma is a condition characterized by reversible obstruction of the airways, heightened sensitivity of the bronchial tubes, and inflammation involving eosinophils. Common triggers include allergens and physical activity, which can provoke symptoms such as wheezing and shortness of breath. Management typically involves the use of bronchodilators to open the airways and inhaled corticosteroids to reduce inflammation. These treatments help control symptoms and improve quality of life for those affected by asthma. Chronic obstructive pulmonary disease, or COPD, is a condition characterized by persistent and irreversible limitation of airflow in the lungs. This disease most often develops as a result of long-term exposure to irritants, with cigarette smoking being the leading cause. COPD primarily includes two main subtypes: emphysema, which involves damage to the air sacs in the lungs, and chronic bronchitis, marked by ongoing inflammation of the airways. Together, these conditions make it increasingly difficult for individuals to breathe effectively. Pulmonary embolism often manifests suddenly, with symptoms such as shortness of breath, chest pain, and low oxygen levels in the blood. These signs can develop rapidly and may be severe, prompting immediate medical attention. To confirm the diagnosis, healthcare providers commonly use CT pulmonary angiography, which allows for detailed imaging of the blood vessels in the lungs. Early detection and treatment are crucial to prevent serious complications. Pneumonia typically presents with lobar consolidation, where an entire lobe of the lung becomes filled with inflammatory cells and fluid. In contrast, tuberculosis often affects the upper lobes of the lungs, leading to the formation of cavitary lesions. These cavities are areas of tissue destruction, and tuberculosis is also known for producing caseating granulomas, which are a specific type of tissue necrosis. These differences in lung involvement help distinguish between the two diseases during diagnosis. Acute respiratory distress syndrome, or ARDS, is a severe lung condition characterized by widespread damage to the alveoli, the tiny air sacs responsible for gas exchange. This damage leads to difficulty in oxygenating the blood, resulting in hypoxemia that does not improve with standard oxygen therapy. On imaging, ARDS typically presents with bilateral infiltrates, indicating fluid accumulation and inflammation throughout both lungs. These features make ARDS a critical and challenging condition to manage in clinical settings. Acute kidney injury is divided into three main categories: prerenal, intrinsic, and postrenal. Prerenal injury typically results from decreased blood flow to the kidneys, often due to conditions like hypovolemia. Intrinsic kidney injury involves direct damage to the kidney tissue itself, with acute tubular necrosis being a common cause. Postrenal injury arises from obstruction of urine flow, which can occur anywhere along the urinary tract. Understanding these classifications helps guide appropriate diagnosis and management. Chronic kidney disease can result in several serious complications. One of these is uremia, a condition where waste products build up in the blood due to reduced kidney function. The disease also often causes anemia, as the kidneys produce less erythropoietin, a hormone essential for red blood cell production. Additionally, patients may develop secondary hyperparathyroidism, which arises when the body tries to compensate for imbalances in calcium and phosphorus caused by impaired kidney function. Nephrotic syndrome is characterized by a notable loss of protein in the urine, known as proteinuria, which leads to low levels of albumin in the blood, or hypoalbuminemia. This condition often results in swelling, called edema, and elevated levels of lipids in the blood, referred to as hyperlipidemia. In contrast, nephritic syndrome typically presents with blood in the urine, known as hematuria, along with high blood pressure and only mild proteinuria. These distinct features help differentiate between the two syndromes and guide appropriate diagnosis and management. Minimal change disease is characterized by the effacement of podocyte foot processes, which is best observed under electron microscopy. This structural change disrupts the filtration barrier in the kidneys, leading to proteinuria. Importantly, minimal change disease typically responds very well to steroid therapy, making it one of the more treatable causes of nephrotic syndrome. Early diagnosis and appropriate treatment often result in a favorable prognosis for patients. IgA nephropathy is a kidney disorder that frequently develops after upper respiratory infections. One of its hallmark features is episodic hematuria, where blood appears in the urine at intervals, often coinciding with these infections. This pattern distinguishes IgA nephropathy from other kidney diseases. The condition results from the deposition of IgA antibodies in the kidneys, leading to inflammation and damage. Early recognition of these symptoms is important for proper management. Gastroesophageal reflux disease, commonly known as GERD, occurs when the lower esophageal sphincter relaxes inappropriately, allowing stomach acid to flow back into the esophagus. Over time, this repeated exposure to acid can damage the esophageal lining. In some cases, the tissue changes lead to a condition called Barrett esophagus. Barrett esophagus is significant because it increases the risk of developing esophageal adenocarcinoma, a type of cancer. Early recognition and management of GERD are important to help prevent these serious complications. Peptic ulcer disease is a condition where sores develop on the lining of the stomach or the upper part of the small intestine. The most common causes are infection with Helicobacter pylori bacteria and the frequent use of non-steroidal anti-inflammatory drugs, or NSAIDs. These factors disrupt the protective lining of the digestive tract, making it more vulnerable to acid damage. As a result, individuals often experience pain in the upper abdomen, known as epigastric pain. Cirrhosis is a condition that leads to significant complications, including increased pressure in the portal vein, known as portal hypertension. This can cause fluid accumulation in the abdomen, called ascites, and the development of enlarged veins in the esophagus, known as esophageal varices. On the other hand, hepatitis C is a viral infection that often results in chronic liver disease. Over time, it can increase the risk of developing hepatocellular carcinoma, a type of liver cancer. Crohn's disease is characterized by inflammation that affects the entire thickness of the bowel wall, known as transmural inflammation. This condition often presents with skip lesions, meaning that areas of healthy tissue are interspersed between inflamed segments. In contrast, ulcerative colitis involves continuous inflammation that is limited to the mucosal layer of the colon. This inflammation always begins at the rectum and extends proximally in a continuous pattern without the presence of skip areas. Diabetes mellitus type 1 occurs when the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This results in an absolute deficiency of insulin, meaning the body can no longer produce this vital hormone. In contrast, type 2 diabetes is characterized by the body's resistance to insulin and a relative lack of insulin production. While some insulin is still made, it is not sufficient to overcome the resistance, leading to elevated blood sugar levels. These fundamental differences influence both the management and progression of each type of diabetes. Graves' disease is characterized by symptoms such as exophthalmos, which is a bulging of the eyes, and a diffuse enlargement of the thyroid gland known as a goiter. In contrast, Hashimoto thyroiditis typically leads to hypothyroidism, where the thyroid becomes underactive. A key feature of Hashimoto thyroiditis is the presence of anti-thyroid peroxidase, or anti-TPO antibodies. These differences help clinicians distinguish between the two most common autoimmune thyroid disorders. Cushing's syndrome is characterized by distinct physical features such as central obesity, a rounded face often referred to as moon facies, and the presence of purple stretch marks known as streak. In contrast, Addison disease typically presents with low blood pressure, increased skin pigmentation, and elevated potassium levels in the blood. These differing symptoms reflect the underlying hormonal imbalances unique to each condition. Recognizing these signs is crucial for accurate diagnosis and effective management. Iron deficiency anemia and anemia of chronic disease can be distinguished by specific laboratory findings. In iron deficiency anemia, ferritin levels are low, reflecting depleted iron stores, while the total iron binding capacity is elevated as the body attempts to capture more iron. In contrast, anemia of chronic disease presents with low serum iron, but ferritin levels are normal or even increased, indicating adequate or sequestered iron stores. These differences in lab values help clinicians determine the underlying cause of anemia and guide appropriate treatment. Sickle cell anemia is caused by a single-point mutation in the beta-globin gene. This genetic change alters the structure of hemoglobin, leading to the characteristic sickling of red blood cells. These misshapen cells can block blood vessels, resulting in painful vaso-occlusive crises. In contrast, thalassemia arises from reduced synthesis of globin chains, which impairs the production of normal hemoglobin and leads to anemia. Both conditions affect oxygen transport in the body, but their underlying mechanisms differ significantly. Acute lymphoblastic leukemia, often referred to as ALL, is the most frequently diagnosed type of leukemia in children. This condition involves the rapid proliferation of immature white blood cells, which can crowd out normal cells in the bone marrow. In contrast, chronic myelogenous leukemia, or CEML, is typically linked to a specific genetic abnormality known as the Philadelphia chromosome. This chromosome results from a fusion between the BCR and ABL genes, leading to uncontrolled cell growth. Understanding these distinctions is important for accurate diagnosis and targeted treatment strategies. Understanding the distinguishing features of diseases across the respiratory, renal, gastrointestinal, endocrine, and hematologic systems is crucial for accurate diagnosis and effective treatment. Each system presents with unique clinical signs and symptoms that help differentiate between conditions. For example, respiratory diseases may be identified by patterns of breathlessness or cough, while renal disorders often manifest through changes in urine output or electrolyte imbalances. Gastrointestinal illnesses can present with abdominal pain or altered bowel habits, whereas endocrine disorders frequently involve hormonal imbalances affecting metabolism or growth. Recognizing these key differences enables clinicians to tailor interventions and improve patient outcomes. Infectious diseases are caused by a variety of pathogens, including bacteria, viruses, fungi, and parasites. These organisms have evolved sophisticated strategies to invade the body and evade or manipulate the immune system. By targeting key components of immune defense, pathogens can disrupt normal immune responses, allowing them to establish infection and spread. This interference often leads to a range of clinical consequences, from mild symptoms to severe, life-threatening conditions. Understanding these mechanisms is crucial for developing effective treatments and preventive measures. Human immunodeficiency virus, or HIV, targets and gradually destroys CD4-positive T cells, which are essential components of the immune system. As these cells decline, the body's ability to defend against infections weakens significantly. This immunosuppression leaves individuals vulnerable to a range of opportunistic infections that would not typically cause illness in healthy people. One common and serious infection in this context is pneumocystis jirovecii pneumonia, which can be life-threatening if not promptly treated. Syphilis is a disease that unfolds in several clinical stages, each marked by unique symptoms. In the initial stage, a painless sore known as a chancre typically appears at the site of infection. As the disease advances, individuals may develop skin rashes and mucous membrane lesions. Without treatment, syphilis can progress to a late stage, leading to serious complications such as gummas, which are soft tissue growths, and neurosyphilis, affecting the nervous system. Recognizing these stages is crucial for timely diagnosis and effective management. Gonorrhea is an infection caused by the bacterium Neisseria gonorrhoeae. It typically presents with a purulent or pus-like discharge from the affected area. If left untreated, gonorrhea can result in serious complications, including pelvic inflammatory disease, which may impact reproductive health. Early diagnosis and appropriate treatment are essential to prevent these adverse outcomes. Chlamydia. Trachomaitis infection is a common sexually transmitted infection that frequently causes inflammation of the urethra or cervix. Many individuals may not experience noticeable symptoms, which can allow the infection to persist undetected. If left untreated, chlamydia can lead to serious reproductive health issues, including infertility. Early diagnosis and appropriate treatment are important to prevent these long-term complications. Tetanus is a serious condition marked by muscle rigidity and intense spasms. This occurs when the toxin produced by Clostridium tetani interferes with the normal function of inhibitory neurotransmitters in the nervous system. As a result, muscles are unable to relax properly, leading to the characteristic stiffness and involuntary contractions seen in affected individuals. Without prompt treatment, these symptoms can become life-threatening. Musculoskeletal and rheumatologic diseases encompass a wide range of conditions that affect the joints, muscles, and connective tissues. A key distinction within these disorders lies between degenerative and inflammatory joint diseases. Degenerative joint disorders, such as osteoarthritis, are primarily caused by wear and tear over time, leading to the gradual breakdown of cartilage. In contrast, inflammatory joint disorders, like rheumatoid arthritis, result from the immune system attacking joint tissues, causing pain, swelling, and stiffness. Understanding these differences is essential for accurate diagnosis and effective management. Osteoarthritis is a condition characterized by the gradual breakdown of cartilage within the joints. As the protective cartilage wears away, bones begin to rub against each other, causing discomfort and stiffness. This often results in joint pain that becomes more pronounced with physical activity or prolonged use. Over time, the affected joints may lose flexibility and develop swelling, making everyday movements more challenging. Rheumatoid arthritis is a chronic autoimmune disorder that primarily targets the joints. It is characterized by inflammation that typically affects both sides of the body in a symmetric pattern. One of the hallmark symptoms is morning stiffness, which can last for an hour or more. The condition is also associated with the presence of specific autoantibodies, which help in its diagnosis and management. Systemic lupus erythematosus is a complex autoimmune disease that often manifests with a distinctive malar rash across the cheeks and nose. Patients may also experience heightened sensitivity to sunlight, known as photosensitivity, which can trigger or worsen skin symptoms. A key diagnostic marker for this condition is the presence of anti-double-stranded DNA antibodies in the blood. These features help clinicians distinguish lupus from other similar disorders. Gout is a type of arthritis that develops when monosodium urate crystals accumulate in the joints. This buildup is a result of elevated levels of uric acid in the blood, which can form sharp, needle-like crystals. The condition most commonly affects the first metatarsophalangeal joint, located at the base of the big toe. This leads to sudden episodes of pain, swelling, and redness in the affected area. Ankylosing spondylitis is a chronic inflammatory disease that primarily affects the spine and sacroiliac joints. It is strongly associated with the HELA-B27 genetic marker, which increases susceptibility to the condition. Over time, inflammation can lead to the fusion of the vertebrae, a process known as spinal fusion. This results in a characteristic bamboo spine appearance on imaging, where the spine looks rigid and inflexible. Sacroiliitis, or inflammation of the sacroiliac joints, is often an early sign of the disease. Dermatologic conditions encompass a wide range of disorders affecting the skin, each with distinct clinical presentations. These conditions may manifest as rashes, lesions, discolorations, or changes in skin texture. Accurate diagnosis often relies on recognizing characteristic patterns, distribution, and associated symptoms. Understanding these diagnostic features is essential for effective identification and management of skin diseases. Psoriasis is characterized by the appearance of well-defined red plaques covered with silvery scales. These lesions most commonly develop on the extensor surfaces, such as the elbows and knees. A notable clinical feature is the Auspitz sign, where pinpoint bleeding occurs when the scales are gently removed. This distinct presentation helps differentiate psoriasis from other skin conditions. Atopic dermatitis is a chronic skin condition marked by itchy, inflamed patches that often appear in the folds of the arms and legs. These flexural lesions can cause significant discomfort and may become red or scaly over time. The condition frequently occurs alongside other atopic disorders, such as asthma or allergic rhinitis. Understanding these associations can help in recognizing and managing atopic dermatitis more effectively. Pemphigus vulgaris is characterized by the formation of blisters within the epidermis, a process known as intraepidermal blistering. One of its hallmark clinical features is a positive Nikolsky sign, where gentle pressure on the skin causes the outer layer to slough off. This condition is driven by autoantibodies targeting desmogleins, which are essential proteins that help maintain cell-to-cell adhesion in the skin. The disruption of these proteins leads to the loss of cohesion between skin cells, resulting in the characteristic blisters. Bullous pemphigoid is a skin condition marked by the formation of blisters beneath the outermost layer of the skin, known as subepidermal blistering. Unlike some other blistering disorders, the skin in bullous pemphigoid usually remains intact when rubbed, a feature described as being Nikolsky negative. This distinction helps differentiate bullous pemphigoid from other similar skin diseases. The blisters are often tense and filled with fluid, primarily affecting older adults. Recognizing these characteristics is important for accurate diagnosis and management. Melanoma is a type of cancer that arises from melanocytes, the cells responsible for producing pigment in the skin. Early detection of melanoma is crucial, and healthcare professionals often use the ABCDE criteria to assess suspicious skin lesions. This method examines 5 key features: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolving shape or size. By carefully evaluating these characteristics, it becomes possible to identify melanoma at an early, more treatable stage. Reproductive medicine and obstetrics are specialized fields that address the health and function of the reproductive system, as well as pregnancy and childbirth. Common disorders in these areas include conditions such as polycystic ovary syndrome, endometriosis, and infertility, each presenting with distinct clinical features. In obstetrics, complications like preeclampsia, gestational diabetes, and preterm labor are frequently encountered. Understanding the typical symptoms and presentations of these disorders is essential for accurate diagnosis and effective management. Polycystic ovary syndrome, or PCOS, is characterized by elevated levels of androgens, which can lead to symptoms such as excess hair growth and acne. Women with PCOS often experience irregular menstrual cycles, making it difficult to predict periods or conceive. The presence of multiple cysts on the ovaries is another common feature. This condition is frequently associated with insulin resistance, which can increase the risk of developing type 2 diabetes and other metabolic complications. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside its normal location. This misplaced tissue responds to hormonal changes during the menstrual cycle, often leading to recurring pelvic pain. Over time, the inflammation and scarring caused by endometriosis can interfere with reproductive organs, sometimes resulting in infertility. The severity of symptoms can vary, but the impact on daily life and fertility can be significant. Ectopic pregnancy is a condition where a fertilized egg implants and begins to grow outside the uterus. In most cases, this abnormal implantation occurs within the fallopian tube. Because the fallopian tube is not designed to support a developing embryo, this situation can lead to serious health risks. Early detection and medical intervention are crucial to prevent complications associated with ectopic pregnancies. Preeclampsia is a pregnancy complication characterized by the onset of high blood pressure and the presence of protein in the urine after the 20th week of gestation. This condition can pose significant risks to both the mother and the developing baby if not properly managed. In some cases, preeclampsia may progress to eclampsia, which is marked by the occurrence of seizures. Early detection and careful monitoring are essential to prevent serious health outcomes. Placenta previa is a condition where the placenta partially or completely covers the cervix, leading to painless vaginal bleeding during the third trimester of pregnancy. This bleeding can be sudden and may recur, making it a significant concern for both mother and baby. Careful obstetric management is essential to ensure the safety of both patients, often involving close monitoring and planning for delivery. In many cases, cesarean section is recommended to prevent complications during childbirth. Psychiatric disorders encompass a wide range of mental health conditions that affect mood, thinking, and behavior. Mood disorders, such as depression and bipolar disorder, primarily influence emotional states and energy levels. Psychotic disorders, including schizophrenia, are characterized by disruptions in perception and reality, often leading to hallucinations or delusions. Anxiety disorders, like generalized anxiety disorder and panic disorder, involve excessive worry or fear that can interfere with daily activities. Understanding these categories helps provide a foundation for recognizing and addressing mental health challenges. Major depressive disorder is a mental health condition marked by a consistently low mood that lasts for an extended period. Individuals with this disorder often experience anhedonia, which is a loss of interest or pleasure in activities they once enjoyed. Additionally, significant changes in sleep patterns and appetite are common, further impacting daily functioning. These symptoms can interfere with relationships, work, and overall quality of life. Bipolar disorder is characterized by alternating episodes of mania and depression. During manic phases, individuals may feel unusually energetic, euphoric, or irritable, often leading to impulsive decisions. Depressive episodes, on the other hand, bring about feelings of sadness, hopelessness, and a loss of interest in daily activities. These shifts in mood can significantly affect a person's ability to function at work, in relationships, and in everyday life. Schizophrenia is a complex mental health condition that significantly impacts how a person perceives and interprets the world. Individuals with schizophrenia may experience hallucinations, such as hearing voices or seeing things that aren't present. Delusions, or strongly held false beliefs, are also common, often leading to confusion and mistrust. Disorganized thinking further complicates communication and daily functioning, making it challenging for those affected to maintain clarity in their thoughts and interactions. Generalized anxiety disorder is characterized by persistent and excessive worry that lasts for at least 6 months. Individuals with this condition often find it difficult to control their anxiety, even when there is little or no reason to worry. This ongoing state of apprehension can interfere with daily activities and relationships. Symptoms may also include restlessness, fatigue, and difficulty concentrating. Obsessive-compulsive disorder, or OCD, is a mental health condition marked by persistent, unwanted thoughts known as obsessions. These obsessions often lead to repetitive actions or rituals called compulsions, which individuals feel driven to perform. The cycle of obsessions and compulsions can become overwhelming, significantly disrupting daily routines and responsibilities. For many, these behaviors are difficult to control, even when they recognize that their actions may not make logical sense.